We have essentially kind of the higher end state-of-the-art equipment in the imaging capacity. So when we try to provide that overall benefit for the patient, a one-stop shop, our main focus in doing this from a technical standpoint was to provide the imaging. And we've done a lot to do that, and it includes the digital x-ray, which is kind of taking a traditional x-ray but making it instantaneous. So instead of extra waste of time and money and taking multiple sets of x-rays because they weren't correct, a patient, we know immediately whether that x-ray is appropriate, and we can adjust it digitally to make it more appropriate, so we don't have to send the patient back again for another set of x-rays. So that's a huge benefit for the patient and for the doctor. We have an ultrasound machine, which we can use in lieu of MRI sometimes to look at tendon injuries and whatnot, and also help us sometimes when we have to localize injections in certain tissues. And then we have my favorite toy, which is the fluoroscopy machine. That's a live x-ray. I can use that when patients come in to me and they have a fracture that needs to be reduced. We put them right in that procedure room. Again, make it very comfortable for them. They don't have to send them to a surgery center or anything. Give them some local anesthetic and use that live x-ray machine, which has very minimal radiation, to reduce their fractures, again, help localize injections, and it's instantaneous. And we can actually see the reduction occur, which is really neat. And the final thing we have is that is an extremity MRI, which again, instead of sending them away to get an MRI at a different center and bring back the films, well, for the joints below the shoulder and below the hip joint and the extremities, we can take those pictures with the MRI to look at the soft tissues, cartilage sequences, and do them here and explain it to them at the same time. Mm-hmm. So it's really convenient. Absolutely. There's a huge financial obstacle to getting these state-of-the-art technologies in the office, and we've been able to accommodate that. And so I would say that probably 5% maybe of offices or less have the capacity that we do to provide that kind of care to the patient. So I think it's really a huge benefit to not only us, but especially to the patient. It just makes it so much more convenient and comprehensive.